started, and here is your. Right. So if you have read and understood, considering it history taking station, kindly begin.
Hello, my name is Dr. Saddam Hussain, one of the exam candidates. May I confirm your name and age, please?
I'm Smith, 54 years old.
Nice to meet you, Mr. Smith. Today I have been asked to ask you a few questions regarding your condition. Are you okay with this?
Okay, doctor.
Okay, Mr. Smith, how can I help you?
Doctor, I'm having difficulty swallowing, doctor.
Oh, since how long?
I'm having this since 10 months, but now it's getting worse, doctor.
Oh, I'm so sorry to hear that. Please let me know further. How did it started? It started suddenly or gradually?
It started gradually.
Okay, and when did you first notice?
10 months back.
Oh, is there anything that makes it very typical, like it's increasing day by day, or anything else?
Like I said, doctor, it has been, it is getting worse since a few weeks.
Oh, so sorry to hear that. Can you please tell me, do you experience just like difficulty in swallowing to solid, the liquid, or for the both solid and liquid as well at the same time?
Initially, I had difficulty swallowing solid foods, but now even the liquids, even when I take tea and all, it's difficult, doctor.
So, do you vomit out all these things which you are taking?
Yes, sometimes.
Oh, so could you please tell me how's your appetite?
Yes, I have lost my appetite. I don't feel like eating.
Okay, so what about your blood loss? Any unintentional blood loss?
I have lost around 2 pounds. In last 2 months.
No, it must be difficult for you. Do you have any swelling around the neck?
No swelling, doctor.
Do you feel any lumps around your throat?
No.
Do you feel the...
No, I didn't
well
notice that.
No?
No.
Okay. Do you feel any heartburn?
No.
Do you have any pain in your tummy?
Sometimes, but it's not really significant.
Okay. During swallowing, do you feel pain during swallowing? Water?
No,
sorry,
no pain, just difficulty.
Okay. Do you feel condition like sometimes you feel that your hands are cold and your mouth and eyes are so dry that you cannot even...
No, I didn't notice anything as such.
Okay. Do you feel any weakness? Do you have any problem during walking?
No, doctor.
Okay, good. Are you suffering from any medical condition? Have you already visited your GP before? You're
I am
diabetic.
diabetic.
Okay. Do you have any surgery before?
No surgery.
Okay. If you don't mind, can I ask a few personal questions?
Yeah, go on, doctor.
Okay, what's your occupation?
I am a teacher.
Okay. Do you smoke?
Yes, I do smoke.
Okay, how many packs per day?
I smoke around 5 sticks per day.
Okay, and do you drink alcohol?
Yes, I drink alcohol.
How many units per
I
week?
drink around bottles of wine per week.
Okay. Is there any similar problem in your family? Any other person?
No, I can't remember.
Same. Okay, so what do you think? What is the cause behind this condition?
Doctor, I'm quite worried. I'm having this since 10 months, and now I even can't take liquids. So it's really worrisome to me.
So what's your expectation from us?
I want to get rid of this, and I want to be able to eat and drink normally like other people, doctor.
Okay. Mr. Samed, I just want to ask a few questions more. You have to give me answer in just a yes or no. So, is there any chest pain? Have you ever suffered?
No.
Do you have a shortness of breath, cough?
No, doctor.
Can you present your
Okay. Do you have any muscle or joint pain? Anything else you want to add?
No, doctor.
Can you present your
Thank you.
please?
Yes, sir. Ma'am, 54-year-old male patient, history of difficulty in swallowing for last 10 months. Initially was liquid and then is gradually increased with the solid as well. He is also loss of appetite and loss of weight for last 2 months. So my main differential diagnosis, first of all, might be esophagus.
Okay. What else
And
would
then
you consider?
It might be Calivia, or and it might be a stomach.
How would you confirm your diagnosis? What investigations would you ask for?
Getting the history and examination, I would like to have some baseline, like a full blood count, and then bone profile check. And during clinical examination, I have mental electrode well, and then get the chest X-ray and esophageal manometry as well to rule out Calivia and gastroesophageal disease. And as my main differential diagnosis is carcinoma of esophagus, so I would like to do endoscopic biopsy.
Okay, what are the treatment options that you can offer to the patient?
Sorry, ma'am.
Treatment alternatives that you can offer to the patient?
Treatment options you are asking?
Yes.
Yeah, it depends upon the condition of the patient, stage of the disease as well. If it is initial stage,
yes.
So we can offer the chemoradiotherapy, and if it is end stage, so we can manage patient on the palliative basis. So for this, we have to insert some metallic stent, and we can go for the feeding vaginostomy after giving the chemoradiation.
Yes, good. Okay, considering the fact that this is the first time you are presenting with us and you were not prepared for this, you've done quite well, almost awesome. Like one or two things could have Because once you would have been prepared, then it would have been totally different. But then this is my opinion. Dr. Karma, can you give your feedback, please? Yes? You wanted to
yes,
say
actually, I was preparing for PR bleeding session, so
yeah,
that's why.
I'm sorry.
But I read this session 2 to 3 days before, that's why.
Okay, that's why. But then it was good enough.
Thank you, ma'am.
Thank you. Dr. Karma, can you please give feedback so that Dr. Saddam can, for next time, can improve? Yes.
Thank you, Dr. Saddam. Maybe his network is not so clear. His voice or network. Otherwise, I think he covered, almost all the things.
Yes.
About the symptom differential diagnosis, he asked about the family history, personal history, eyes, systemic review. He asked about all that. Maybe he missed one question about whether the food gets stuck, bad breath, or any gargling sound or wet voice. He missed that, I think.
Halitosis, etc. Yes.
The rest, I think he asked.
He asked, okay. Lump, maybe. He even covered he even covered the pain, even the vomiting.
Yes.
Bowel habits he didn't ask. Or did he ask?
Yes, bowel habits
he didn't ask the bowel habits.
Yes.
Even he covered the neurological symptoms like weaknesses, etc., autoimmune symptoms, symptoms, even the constitutional. But his network was not good enough. I could understand only one provisional diagnosis of esophageal carcinoma. Others I couldn't understand. Network was not clear. Anyway, the first one was correct. So, good. Thank you.
Thank you, ma'am. Thank you.
Thank you, Dr. Karma. Thank you, Dr. Saddam. Started the timer.